This has been a huge relief for Barnett Park, which has been overwhelmed by individuals seeking to be tested for COVID-19. Over the past 2 days, Orange County Health Services workers have averaged 1,800 to 1,900 tests a day at Barnett Park. Monday was 1,905 and Tuesday 1,816. So between the two testing sites, 3,000 tests a day are being administered at the Orange County sites. Now, when we look at the numbers across the country, Johns Hopkins reported that 85,000 new cases are being reported per day in the U.S. 270 people are dying per day in the U.S. from COVID-19. Between the two testing sites, I will tell you that we know that the demand for getting tested and knowing one's status is high within our community. I also say to all of us, please go get vaccinated and assist us in the process of combating the spread of the disease within our community. You can choose the Pfizer or Johnson & Johnson at Barnett Park or any of the local pharmacies found at CVS, Walgreens, and Publix. There are no vaccines being given at the Econ soccer site at this time. Both Barnett Park and the Econ soccer complex have drive-through facilities set up to serve the community 7 days a week between the hours of 9 a.m. and 5 p.m. It is advised that you get in line before noon, as capacity is generally reached by early afternoon. There are no walk-ups at this time. There's also a maximum of 4 individuals per vehicle. Because of the significant uptick in virus transmissions around the country and here within Florida, we are once again seeing cancellations of events at our Orange County Convention Center. Of course, many of you may have already reported on that. As Florida faces its worst public health crisis since the coronavirus pandemic started nearly 18 months ago, we continue to see now in the foreseeable future, at least for the remainder of this month, shows being canceled. The American Association of Neurological Surgeons has pulled out from their convention, which was scheduled for later this month. Because of what is happening really all over the country, we had seen a significant readjustment or revised anticipated attendees at that event. The 1,000 attendees was expected to have an economic impact of about $2.5 million on our community. The Electrochemical Society also canceled an event which was scheduled for October. The number of attendees projected for that event was about 1,100 with a $2.8 million projected economic impact. And these numbers, again, are revised because of what is happening around the country. All of the attendance numbers were being pushed downward. In addition, we reported earlier this week that the American Association of Perioperative Nurses and the North American Association of Food Equipment Manufacturers were canceling events. The nurses group anticipated about 5,000 attendees with a $12.8 million economic impact, and the American Association of Food Equipment Manufacturers was projecting 10,000 attendees with a $25.6 million impact. Between these 4 conventions alone, we're talking about approximately a $43.9 million economic impact on our community. Mark Tester, our Convention Center Executive Director, is here should we have additional questions about that later. Now, in terms of the state of Orange County and the numbers, there are now 173,503 coronavirus cases documented within our county. That's an increase of 3,758 cases since our news conference on Monday. Again, remember, over 1,000 new cases per day. The Department of Health reports that yesterday, Wednesday, there were 1,409 new coronavirus cases in Orange County. 98% of these cases were among unvaccinated individuals. The number of deaths in Orange County, sadly, I have to report, now 1,417. Our 14-day positivity rate continues to rise. It has increased significantly. I say significantly because 2 points since Monday is significant. We were at 17.97%. Today we're at 20.83%. Now, again, the good news I shared earlier was that we're seeing amongst the eligible group of individuals who can get the vaccine, we're up to 63.43% of our population that is eligible has received at least one dose of the vaccine. We can do better. We're trying to get up to that 79 or 80%. We need the help of our entire community, however, in order to get there. Orange County continues to monitor our wastewater systems, and I will share some data with you. We do have Ed Torres, the utilities manager, who is here, a director that is here. The data collected by the program helps the Centers for Disease Control and local authorities better understand how the virus is spreading within our community. This system also alerts authorities to spikes in infections 4 to 10 days before positive case numbers would be available. At our Eastern Water Reclamation Facility, we are seeing a 1,704% increase in COVID concentrations in an 11-week time frame. In the Southern Water Reclamation Facility, we are seeing a 643% increase over the last 11 weeks, and the Northwest Water Reclamation Facility is seeing a 1,583% increase in approximately a 6-week time frame. So that's concerning to me. Earlier this week, the federal government and the CDC have issued new temporary protections from evictions. The order is in effect until Sunday, October the 3rd of this year. Residents who are seeking to apply for this temporary protection must complete and submit a CDC declaration form to their landlord or rental management company as soon as possible. More information regarding the order can be found at cdc.gov. As a reminder, Orange County's Emergency Rental Assistance Program is still open. The CDC moratorium does not affect those applying to our program, which may be able to help eligible residents pay up to 12 months of past due rent and 1 month of future rent, up to a total of $20,000. As of this afternoon, more than $5.9 million have been distributed to keep over 1,000 families in their homes, a slight increase from our previous news conference. We're at 1,071 families have taken advantage of this at this point. Residents can get information by going to ocfl.net/rental assistance. And now let me just talk a little bit about the state of emergency. I have extended the local state of emergency for another 7 days. I want to be clear on what this means for Orange County residents. The executive order allows me to continue making decisions and managing the changing dynamics of the current surge in the best interest of the life, health, and welfare of Orange County residents during this crisis. This keeps our Emergency Operations Center at a level 2 activation to better monitor the surge in COVID-19 cases. It also puts me in a position to strongly urge our visitors and residents to wear a mask when indoors. This request is for vaccinated and unvaccinated residents. In our efforts to increase the rate of vaccinations, I've asked that you please not forget the I Got My Shot trailer that is moving throughout the community. The vaccine trailer will be at the Northwest Community Center on W.D. Judge Drive this afternoon. Tomorrow afternoon, it will be at the Citrus Square Neighborhood Center on Hickey Drive. On Saturday, the vaccine trailer will be at the Winter Park Farmers Market in the morning, then at the Waterford Lakes Shopping Center from late morning until early afternoon. My staff and I are continuing to evaluate whether or not to open additional testing sites and or vaccination locations. So you'll hear more about that as we finalize details. I want to commend Superintendent Barbara Jenkins and the members of the Orange County School Board for mandating the use of masks for employees, parents, and visitors in all Orange County public school facilities for the next 30 days. It is the right and responsible thing to do for the 209,000 students and 25,000 employees who will be part of the new school year next year. Mr. Scott Howard is here to represent the school district. This afternoon, as we move forward for any Spanish-speaking media outlets, I have Ms. Yesenia Negron, one of our senior planning assistants, who will assist me if Spanish translations are needed. At this time, I'm going to turn it over to Dr. Raul Pino to help fill in the gaps. Thank you.
I don't think that you left many gaps. So good morning, everyone. Good afternoon. Good afternoon, everyone. A little bit confused. So the mayor gave you a series of data that I'm not going to repeat. I'm just going to make emphasis in some points that I want to call your attention. It is too early to say, but there are some signs that things may change a little bit for the positive. We'll see. But the important sign is that we have seen an increase in the demand for vaccines. The numbers are not huge, but they are coming about 300 to 200, between 250 to 300 a day, some days more than others. But we will take any increase. That's positive. For example, yesterday in the county, there were 2,672 vaccine doses given. Now, remember, this number could change, probably up, as data gets uploaded, and some places don't upload the same day. So that could be a little bit lagging behind. So this number could be higher. And another number that I want to give to our population is 12 to 17 years old. That percentage with at least one dose is at 47%, which is has increased since we were reporting to you a couple of weeks ago in the 20s and 30s. So there has been a significant move. So probably a lot of the increases that we have seen is in the younger population that is going for vaccine, which is critical to control this pandemic. Sadly, the mayor announced that 15 additional deaths were reported to the state. And if you follow these press conferences, that number is a little bit higher than we were recently accustomed to. The ages were from 30 to 87 years old. The median age is 67. And with that, I also want to call your attention to the fact that the median age in death has also significantly decreased from where we were at the highest of the pandemic before. That means that younger people are dying from this. For example, in October 2020, when we got to the highest age, was 80.5 years old. And it has been between 76 in the 70s. For the month of June, that average is 65. We haven't calculated July because we're still getting deaths reported, so we'll wait a little bit for that. But that's significant. And the number of deaths for last month, that is July 2021, has increased to 45. The prior month, June, there were only 31. We already have 2 in the month of August. Our vaccination rates continue to increase, as the mayor mentioned to you, and for all eligible residents with one or more doses, we are at 63.43%. And another group that I want to give you just to see how well we are doing in this age group, residents over 65 with at least one dose are at 82.6% vaccination rate. We also have been in conversation with the VA to try to get data from at the federal level, but the VA was kind enough to let us know on the ballpark that they have given more than 70,000 vaccines in their facilities in our county, so that put us in good numbers. There has been a lot of debate with regard to the Delta variant, and we all should assume that most cases are the variant. The fact that 300, 400 were reported to the state, and we have it in our data, is a significant to the fact that at this point, more than 50% of all cases should be to the Delta variant as is spreading and continue to spread. With that, I will answer any questions that you may have.
All right. Okay. Just as a reminder, we will move the microphone around to those who may have questions. Again, if we have any questions in Spanish, we'll have to give Yesenia an opportunity to come forward. I believe I saw Commissioner Gomez Cordero here earlier, and we also have Director Danny Banks, our Public Safety Director, here. And again, we have Mr. Ed Torres, our Utilities Director, and Mark Tester, our Convention Center Director, who are here. And with that, I'll open it up for any questions at this time.
It's Steve Hudak from the Sentinel. I guess I'm asking you guys to do some crystal balling here. With Ed's information about the wastewater stream and the increasing death rates, what's the next week or two going to look, and what are the hospitals telling you?
I think Dr. Pino is better respond to that.
It's difficult, the crystal ball, to guess. So if the pandemic continues to behave the way that has behaved in the past, we should see an increase, we should continue to see an increase in the number of hospitalizations next week, and we should continue to see an increase in the number of deaths. And what I'm saying that because that's data that goes beyond ER visits and number of cases. And as ER visits and number of cases continue to increase, and this takes about 2 weeks to ripple into the other data points, we suspect that the next 2 weeks are going to be rough. Now, we have seen a deceleration on the increase on the number of cases, but it's too early to say. For what I'm trying to say, earlier, like a week ago and the week before that, those increases were of the 50 and 60% from week to week. The last week increase was less than that. And if that happens this week when we end, then we can start projecting some things, but it's a little bit early. But as we increase the number of tests, if that, and the number of tests that we are performing daily, and if that continues to decrease from week to week as you increase the number of tests, then it's an indication that things are improving.
Lauren Cervantes from WKMG News 6. Dr. Pino, you mentioned an increase in vaccinations. What percentage of those are residents that live in Orange County versus outside of the county?
I don't have the percentage, but I have the total number, and I can give you that. Now, remember that I always said this, that we should take pride on the number of residents from outside the county that we are vaccinating, because not everyone that works in Orange County live in Orange County. So the total number of vaccines were 2,672, 2,650 were residents. So only 12 were not residents. 22. But again, those numbers could change as data gets entered.
Holly Bristow with Fox 35 News. The question is for you, Dr. Pino. We know that adults, basically teachers, teachers' aides, parents entering school buildings are going to have to be wearing the masks for the first 30 days of school starting. What would your advice be to parents sending kids back to in-person learning next week? Should they be forcing their own children, since the government isn't, to wear masks in school?
So I don't think that the word is forcing. I think parents have a choice. They should be informed. They should look at the data that is out there, what we are saying here, what everyone is saying. The governor's orders have not prohibited anyone from wearing a mask, so people can still make that decision. My children are both vaccinated. I have advised both of them to wear masks until this phase goes out. When we get out of this peak, for vaccinated people, it's going to be safer to be without mask. And the mask is not a solution to the problem. The solution to our problem is increasing vaccination rates. And it should be no mask. It should be vaccine, no vaccine. So let's get vaccinated so that we don't have to wear a mask.
Lauren Seabrook, Channel 9. Excuse me, Dr. Pino, I know you just touched a little bit on this, on people from outside the county getting their vaccines, but there's some concern in numbers around the state that tourists are getting their vaccines here, and those numbers are being counted toward what we would consider herd immunity. So I'm curious if you know, are you guys tracking the difference in what our herd immunity could be with residents versus when you add in the tourist? And is that herd immunity changing? Is that number changing with the Delta variant?
Those are all good questions. But tourism is what we live off of, one of the things. It's probably the main engine to our economy. So we should try to make it as safe as possible, even for travelers, because travelers are coming to stay. So they stay for 5 days, they stay for 6 days. So that is important piece. Now, for those who have declared that they were non-resident of the United States, we have about 8,000 doses in our county. That a little bit over 8,000 doses that we know. It's probably higher than that, but that's only if the people say, hey, I don't live here. Now, the airport was the one probably doing most of those cases, although people from international origins have shown up in many of our locations. Now, if they declare, we can easily remove them from the calculations, and that in that sense, it will not affect what we are calculating. But 8,000 doses out of 1.4 million doesn't make any impact on the data really in any direction.
And Doc, touch on the VA.
Yes, also the mayor was advising me to touch on the VA data. That's another data that we have not included in the calculation that at some point will elevate the calculation. So we could see from another day to another day a big jump when we receive that data. We understand from conversations with the VA that they have given about 70,000, but they only not serve, our residents, they serve people from the region. So when we can get more granular data, that data will jump. Now, that 70,000 will make a difference.
It's still 79 with Delta?
So the herd immunity is an issue because you cannot calculate, that's an approximation, because each area, depending on the time and the level of virusing out in the community viral load is what you need. At these levels that we are, expert national are saying that we need 80% to be able to contain what is happening.
This is Emilio from Telemundo. I'm way back here. I have a question for the director of the convention center. If we can expand a little bit on the impact, economic impact on the county with the cancellations. Do we expect to see more cancellation than if we have a plan to recover after this is all over?
So thank you. We do have 52 events that are planned and still contracted for the rest from now until the rest of the year. We are in constant contact with every one of those customers. We have been in constant contact helping them with their own customized health plan. A lot of them, matter of fact, prior to June 16th, every one of the events that we had required masks. None of them have not, in the last 30 days, have recommended, and now we're seeing a trend. First of all, groups that are in-house, have been in-house recently, that are recommending, you see anecdotally the numbers going up. Just by walking around, you see people that are wearing more masks. And groups coming in the next few weeks and even in the next month or so are now beginning to require masks. So next week we will have the MegaCon event, and they have indicated that if you're going to come to that event, that you'll be required to have a mask. So we did prove safe as the first convention center to really open, that if you come in and you wear a mask and you follow our other protocols, like our GBAC Star accreditation with what we're doing with all the cleanliness and disinfection, that you can have an event safely. And with the mask coming back on and being required by the events, we're hopeful that they will continue to come on. We have not heard any other events that have announced that they've canceled.
I have question for Dr. Pina, and I don't know if the next question Mayor George Demings can answer. Over here. La pregunta sería, en español, agradecería la respuesta. En cuanto, tengo tres preguntas. La primera sería, ¿cuántos niños están en cuidados intensivos en el condado Orange? Si hay niños, ¿cuántos niños están en cuidados intensivos? La segunda pregunta sería, si tienen un plan B, en caso de que haya un incremento en las hospitalizaciones en las próximas semanas, porque en el sur de la Florida hay 6 hospitales que tuvieron que habilitar las salas de conferencias para colocar camas. Entonces, si hay algún plan B. Y la otra pregunta, si me puede decir en español, por favor, el incremento, la buena noticia del incremento en la vacunación en el condado. Gracias.
So the question were if we know of any child in intensive care units, if we can say about the increase in vaccinations in Spanish so that the public can have access to information, and if we have a plan B in case that the hospitals gets overwhelmed with patients. So no tengo acceso a la base de datos ahora en estos momentos de los niños hospitalizados. Entiendo que hay algunos hospitalizados. Lauren hizo un trabajo ayer o antier que estuvo en las noticias acerca de las hospitalizaciones, pero yo no tengo acceso a la base de datos en estos momentos. Estamos trabajando para tener acceso a esa información de nuevo. Y con respecto al número de incremento de las vacunaciones, hemos visto un incremento de las vacunaciones en los niños de 12 a 17 años. Y ha habido un incremento alrededor de 200 a 300 vacunas diarias. Hay algunos días que sube un poquito más. Eso es positivo. Aún no estamos a los niveles que deberíamos. Hay suficiente vacuna. Es importante que la gente vaya a vacunarse. Con respecto al plan B para los hospitales, nosotros no tenemos ningún plan porque esos planes son ejecutados por los hospitales y nosotros no los regulamos a ellos, pero sí, ellos sí tienen plan. El problema que la gente tiene que entender es que una cama en el hospital no es solamente la cama, porque la cama es lo de menos, no se acuesta donde quiera. Es el personal que va con esa cama. Es la enfermera, el anestesista, el médico, y eso es lo que está necesario. Para poder habilitar una cama, tú tienes que demostrar que tienes el personal necesario para ofrecer esos servicios. So, in English, with respect to the plan B for the hospitals, we do not regulate the hospitals. The hospitals have their own plans, and they do have several plans in place. Now, what I was explaining is that people need to understand that having a bed in a hospital is not having a bed in a hotel. It's not just the bed, it's what goes with the bed. Because they have to demonstrate that you have the nurses, the assistant, the lab, the resources, the oxygen, the tank, the monitor, everything that goes with a bed. And that's where the hospitals are having problems. Because, you know, they have 3 shifts, they have to increase employees, and that's why they close all the operations so that they can shift personnel into these areas of higher need. But it's becoming also very difficult for some hospitals to find licensed individuals, because we are all competing for those licensed individuals to give vaccines, to do tests, and other hospitals and other systems. So that's part of the issue that we are facing. With regard to the increases, I said that in English that we have increased about 200 to 300 a day, although some days could be a little bit higher than others. Thank you.
Question for Mayor Demings. By extending the state of emergency for another week, you're obviously trying to do all you can to make the community as safe as possible, with the hospitals reporting that well over 90, maybe even 95% of the people that are in the hospital are unvaccinated. What's your level of frustration that clearly vaccines are working and there are so many people who won't go get them?
Well, that is the frustrating part of what we are experiencing. But again, as I started out, the good news is we are seeing an increase in the rate of vaccinations for many reasons, I believe. We have not only the public sector that is now mandating certain categories of employees get vaccinated, but the private sector is doing the same. I believe that as a result of some of that, that is going to drive an increase in the rate of vaccinations within our community. Again, this is best practices that we're seeing. With school opening next week, that creates some additional challenges for us, but the action that the school district has taken is one more step. As we add layers to trying to better protect our community, the state of emergency allows me some flexibility in the procurement as we are making decisions about bringing online additional testing locations and potentially additional vaccination opportunities for our community. It gives me some flexibility in that regard to be able to do it even without being able to specifically institute mandates that have now been prohibited under the current Florida law. We are moving forward in the best manner possible. And so for me today, having the conversation with mayors and healthcare experts from around the country, it validated the approach that we are using here as one that is based on science, it's based on data, and we're spot on in terms of what we're doing in this community.
Your message to people who won't get a shot?
Well, my message to people who won't get a shot is, again, we urge you to do so. By failing to do so, you are increasing significantly the chances that you eventually are going to contract the disease and perhaps spread the disease to others. Again, we see the daily rate of people getting infected going up, and the death rate is going up. And that should be concerning to all of us, because for those who are unvaccinated, you heard me say this before, eventually, if this virus has not impacted you in your home, eventually it will. Almost daily now, I am notified about someone who I personally know who is not only contracting the disease, but also dying of the disease. And so that's sad. That's what we are trying to prevent from happening in our community. And from listening to mayors all over the country, this has been primarily a local phenomena. I always say that when people dial 911 in their various cities, counties, and communities, they dial 911 because they want a local response. It is our first responders who respond to take care of them. It is the healthcare workers who are taking care of them in our hospitals. And by the way, let me just say to our healthcare workers, thank you. They're doing a phenomenal job. One of the hospital executives mentioned to me the other day that at the height of the virus previously, businesses were really doing various acts of kindness for the healthcare workers, offering discounts or free meals and all of those types of things. I would ask our community to once again be sensitive to the demand that we are putting now on our healthcare system and those first responders. We're at a critical moment where the jobs that those men and women are doing is intensifying significantly. So if there's any way for our community to once again show them the love, show them the appreciation as they need to get through these next few weeks. I believe that we're at a point now in this community where this next 3 or 4 week period of time is going to be really critical. It will set the stage for how we are going to perform, I believe, for the foreseeable future, for the next few months, perhaps through the end of the year. If we come together and do the things that our experts are telling us or asking us to do at this point, then it will set the stage for us. I don't want to see our economy continue to see events and shows and other things that are canceled. But that is the responsible thing that is happening at this point as we continue to try to live with the virus. But as we move forward, if we don't do this right for the next 3 or 4 weeks, we're going to have some misery that we're going to go through. And Dr. Pino has given you the cautionary tale at this point that things can get much worse if we don't come together. So again, I applaud our community because they are listening, they are responding, and we're just asking them to continue to respond in a positive way. Don't let the negative energy, those who don't want to comply with these suggestions overwhelm you. You make some individual decisions in the best interest of your family based upon the data and what is really happening in our community. So thank you for the question. A long way to answer it, but that's what I get paid to do, I guess. So thank you. All right, other questions?
Mayor, I have a few that were texted in. This first one comes from Nick Pipentonis from WFTV. His question reads, are there discussions or plans underway to open a third testing site since both existing sites are hitting capacity? If so, when? And has there been any offer from the state to provide additional testing resources or sites?
I'm not aware of any additional resources the state has offered up at this point. We have been pretty much left to our local ingenuity to figure that out for ourselves, but we certainly will welcome any assistance from the state in that regard. And yes, we're having those conversations, and hopefully perhaps before the end of this week we'll be able to make some announcements. But we have a lot of logistical things to consider and put in place behind the scenes that we are working on.
This next one comes from Ryan Gillespie in the Orlando Sentinel. His question reads, has there been any further discussions about safety measures at the convention center, such as requiring attendees of conferences to wear masks?
I think Mark Tester, the executive director, addressed that. The events that we are hosting in our convention center, all of them are using masks and using all of the CDC sanitary protocols that's been put in place. We invested in technology. We have partnerships with our local healthcare systems to provide expert advice to them. Dr. Pino in the Department of Health is providing good advice to those show planners as well. So that's the answer to that question.
From Ryan Lynch in the Orlando Business Journal, Mayor Demings, do you expect to reconvene the Economic Recovery Task Force again? What factors may require the task force to meet again?
We are monitoring the situation, and we had a meeting with the task force earlier this week. What will drive whether or not we reconvene for another meeting will be the numbers, the data, and the response that we're seeing from our business community. That will drive the need for whether or not we will reconvene or not.
This one from Patricia Mazzi from the New York Times. If Mayor Demings, if we are unable to reach really high levels of vaccination, should we be preparing to live with COVID for the long run, and what would that look like? Are you going to have these spikes in full hospitals several times a year? Will we be debating masks a year from now?
I don't know the final answer to that, but I hope not. I hope we're not debating whether or not we still have to wear a mask or not. I believe that because we have the availability of vaccine today, I believe that it is unlikely a year from now we will continue to have this conversation about COVID-19. However, based on the call with Johns Hopkins that I was on earlier, they explained that variants are being developed every time that a human being is infected. It creates the opportunity for the virus to mutate, and it is the unknown with those mutations that create the uncertainty for all of us. So again, I think we hold the cards at this point because there's an available vaccine for those 12 and older. And perhaps, I've heard Dr. Pino say that some are saying maybe by the end of the year there may be some form of vaccine available for those under the age of 12. The sooner we get to having vaccine widely available for all segments, all ages of our population, I think will put us in a much better position. So I just see in terms of the rate of improvement with the development of vaccine. Hopefully in a year we won't be having the conversation about this. We'll be reflecting on how we responded and what the data says to better prepare us for the next public health crisis. All right.
Lastly,
yes.
Last question, I promise. This one is for Dr. Pino from Fox 35. Dr. Pino, what would you say to parents who are hesitant about getting kids 12 and older vaccinated, worried about the effects that this vaccine could have on adolescents going through puberty?
It shouldn't have any. The components of the vaccines do not have any interaction with the hormones that kids are going through when changing from adolescence into adulthood. I think what parents need to balance is, do you want a sick child home or do you want a healthy child in the school? Do you want to have to take in 14 days or 10 days of isolation from work and have to take care of your child? Or do you want to protect that child and the family? Because remember, the child is going to be in and out. And also, do you want to protect yourself if your child is less than 12? And protecting this child in this case is vaccinating everyone that is around the kid. Now, there are individuals who can be vaccinated. They are going through transplant, they are going through cancer treatment, or they have active AIDS, or, there are many reasons. And we ethically have some responsibility as a community with those individuals that cannot protect themselves, and we have to do as much as we can to protect them as well. Because those are someone's cousin, someone's mom, someone's uncle. And what I alerted people, because I have taken a few calls on this, is the type of guilt and remorse that comes with having transmitted this to a member of your family that may die from it because it's elderly, because it's fragile, because it has pre-existing conditions. And that had happened. And that's a regret that we all can avoid by being vaccinated.
All right, thank you all for your presence today. It is our intention to hold the next press briefing on this coming Monday at 11 a.m. So if things change between now and then, through our communications division, we'll put additional information out. So thank you. Have a great weekend.